My name is Carly. I work at Pro Health Emergency Room here at Waukesha Memorial. I've been here for about 2 years.
My name is Sarah. I've worked at Pro Health Waukesha Memorial Emergency Department for 9 years, and I've been an ER nurse for a total of 11 years.
If someone overdoses and comes into the emergency room, we have a lot of resources here. Starting in the emergency room, we would first treat them for the initial overdose, but if they were to stay here in the hospital and be sent to the intensive care unit or up to the floor, they work with our social workers here to have different outreach programs or places that they can go once they're discharged. So that way we can reduce the number of times that they come back to the emergency room.
Narcan is a second chance for many patients, whether it's identified as so or not. I think that everyone deserves a second chance, and in the emergency department or wherever they're receiving the Narcan, that does make a difference for every one of those patients and their families. I think I absolutely have noticed that the stigma around Narcan and around addiction has improved, meaning it's become less. I think that it's more of a conversation that people aren't afraid to have. And I think that addiction, unfortunately, touches everyone in our community. And it doesn't have to be anyone that you acknowledge has a problem or that you perceive has a problem. It can be someone who makes a choice one time or who doesn't make a choice and has an accidental overdose. I think that's very important to identify and to get out there, is that addiction has always been present in our society. It's not going to go away. And I think that Narcan has given us the availability within our community for everyone to change someone's life, regardless of their judgment, perception, or what have you about Narcan and its use, or opiates and their use. And I think when I had seen people 10 years ago come into the emergency department, they weren't sure where to go for help. And I think that it's become a little bit more clear. There's been more resources that are available, that people do have tools to look up and seek out resources aside from going to the emergency room for care.